Hey everyone, I'm here to talk to you about unions. The National Labor Relations Act, or the NLRA, overseen by the National Labor Relations Board, was established in 1935 to protect employers' rights to form or join unions and engage in collective bargaining. This act protects the rights of private sector employees to unionize and seek better working conditions without fear of retaliation. It is governed by five appointees by the president. The NLRA spells out what the employees can do and what the employers are obligated to do. Under Section 7 of the NLRA, employees have rights. Employees can form, join, or assist labor organizations. They are allowed to collective bargain through union representatives. They are allowed to engage in other activities for aid or protection. Under Section 8, employers must not interfere with employees exercising their rights under the NLRA. Employers are prohibited from interfering with the union organization, and both parties are to work together in good faith. When looking at a union related to healthcare, there are areas that should be addressed. How would the union be involved in the workplace, and in what specific areas? How would the union dues affect my income, my take-home pay? And has there been success related to the union's involvement with the employment place? How does patient care affect participation in the union? Being part of a union within healthcare system has both positive and negative outcomes. According to a study by Ahmed and team, which examined over 14,000 people, of those, 13.2% were involved with the union. On the positive side, employees took home more money per week. They had greater access to retirement plans and complete health insurance coverage. There were fewer wage disparities between white workers and minority workers. And on a potential negative note, they did work more hours compared to non-union workers. Nursing unions were reviewed in 2024 by Andrew Durkis and his team. They found that unions did seek to improve working conditions. They found that patient outcomes improved, but access worsened. And this is because the union would limit the ratios or the number of beds available according to the staffing levels. Communication should always be looked at for all areas of improvement. Active listening and being receptive to suggestions or feedback is the first step. Having management make rounds to talk to employees about their experience is important. Having employees sit in on committees or be on committees can expand connections and collaborations with other disciplines, and allowing staff to have an active voice that impacts the functioning of their own unit can improve morale, safety, and patient outcomes. The question about whether the nurse should be worried about being involved with the union. A nurse, or being worried that they might be fired. A nurse should not be concerned about being fired for involvement in the union as long as the nurse is acting in good faith. They are protected under Section 7 of the NLRA. If the employer attempts to fire the nurse, they will be held liable under Section 8 of the NLRA. And the nurse should still adhere to organization policies and patient care standards. I really appreciated these questions. I wasn't real familiar with how union was involved with healthcare because I've never been on that side of it. Kind of saw it as one-sided, but I really appreciated this question to see how it sort of translated out. So I hope you all enjoyed as much as I did, and have a great evening.